Hello, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator, and you're watching Aging Strong, which is sponsored by the Quincy Health Department. Today's topic is an exciting one for me. I mean, what topic is not exciting for me, right? But this in particular is very exciting for me because for those of you who have been to pharmacies and look down the aisles and get really overwhelmed with all these different over-the-counter medications, brand names, and store brands, what to take, especially when you're under the weather, trying to figure out which one is the best one for me. Well, today my guest speaker is Dr. Donna Bartlett. She is a professor at the Mass College of Pharmacy and also the author of MedStrong, which is a wonderful book that she'll talk about later on. But today her topic is over-the-counter medications, herbal preparations, and also supplements. So Donna, welcome.
Thank you so much. And just wonderful to be with you, Debbie. I love our collaborations throughout the years. So thank you.
Thank you for being here. So, before I know you have a beautiful presentation for us and can't wait for you to go over them, but can you just tell me, as a pharmacist, what are your thoughts about over-the-counter medications in general? Are they great for the consumer because they're so readily accessible and they don't have to go see their primary care doctor or primary care and nurse practitioner to help take care of them? Is there a good and a bad to these type of accessible medications, I guess, or drugs?
Yeah, so I definitely think, there's good and bad and in both sides. So wonderful that, if you need something and it's not urgent or chronic, then great. You can treat and maybe get through a fever or a flu or a pain or something of some sort and relieve that area of concern. However, not every medicine is good for each person. So we have to be very careful about what we're choosing. So what might be good for someone might not be appropriate for somebody else. And how do we know that? Unfortunately, and I'll be talking about this a little bit, is the information on the packaging is so small, and who's paying attention to it? Do they understand it? And what about that health literacy side too? Or are you just taking it because, oh, so-and-so said it was good for them, so you should try it. So really balancing the reasons why and is it appropriate for you is really important before taking something.
Yeah, definitely. You talked about health literacy. How important is that? And for those people who know what that means, but for others who may not know what health literacy is, can you just kind of quickly let us know what that is? What is the definition of that?
Sure. So literacy is just being able to read basically and understand. But health literacy is a whole nother way of understanding the healthcare literature and what is the information being provided. So do you understand how to take something, what the concerns are, when to call a doctor, what does the dosing mean? What does every 12 hours actually mean for you? Or what does twice a day mean? Or, so are you in? So now we get not only into the literacy part, but the numeracy part. Are you able to understand that? How much of a dose is, especially if you're measuring something, if it's a liquid, how much of that do you really want to give somebody or take yourself? And then what is every 4 hours? Are you jotting it down to remember, oh, when you took it, and then what the next 4 hours would be when you can take it again? Or are you losing track of all of that? So it really is important to understand not only why, how, and if it's a safe product for you, but how much and when to take it.
Yeah. There's a lot of information to really understand as far as what to take. I mean, even as an adult dosage is certainly different from children's dosaging, but adults come in different shapes and sizes. There are really, really small framed ones who are very short and petite. And do they qualify for adult dosages and vice versa? Children, my 18-year-old is, 5'10", and he weighs, over 150 pounds, so, just keeping that in the back of people's minds, especially when you are managing your ailments with over-the-counter medication is important. Would you agree?
Absolutely. And it's not just the size, but sometimes it's how our kidneys are functioning, how our liver functions, what other meds we're taking. So it could be that someone, like you're saying, petite, maybe some meds are dependent upon the size of the person. But sometimes, and most often, as we become adults, it's often how well are our kidneys functioning? How well is our liver functioning? And what is the whole absorption and distribution of the product within our system before it's eliminated. So,
Yeah.
so thinking about that, and something that you might have taken when you were younger, now years have gone by, and you're taking different meds. Your body's now different. It might not work the same as it did before, and it might not be the correct medication for you as it was maybe 10 years before.
Definitely. I'm glad you mentioned that, being able to metabolize, the medication properly through the kidneys and the liver is so important. And that's why it's so important for people who are taking over-the-counter medications, supplements or herbals, to share that with your primary care provider. Because then the primary care provider can look at the whole picture and be able to, say, okay, looks like your kidneys are good, your livers are good, what are you taking this for? Is it helping you? They'll be able to best advise which ones you should avoid, right?
Absolutely. And I always talk to your pharmacist too. If you're picking something and you really can't necessarily read or understand that back label, and you're not certain if it really is an appropriate medicine for you and the other meds that you're taking, ask the pharmacist if it's appropriate for you. They are accessible for you, and that's why we're there. We're there to help people understand the meds that they're taking and to help with over-the-counter selection as well.
Yeah, definitely. Something as simple as laxatives, right?
Yeah.
That's a whole new presentation altogether. I know I don't want to open up a can of worms, but as you
I think
know,
any group.
yes, any group, because it has different formulations, liquid, powder, capsules, and all that, and they all do something different. So definitely talk with your pharmacist who's there for you to be able to kind of figure out what is the best for your current state of condition. So I don't want to take up too much from right now with, our discussion. I know there's going to be plenty of time for that after the presentation. So, I'll have you put on your slides, and we'll be able to learn more from you about over-the-counter medications.
So I just want us to be MedStrong, and MedStrong just means that we're taking only what we need. It's appropriate for us, and we're only taking it for the amount of time that is necessary. So we don't necessarily want to keep taking things forever, and those are the things we need to balance and understand. So we have to be careful with the over-the-counters that we take, because it's really some of the choices that we're making as healthcare consumers. So I first wanted to just think about the aisles, like you had said, Debbie, in regards to, oh my gosh, look at all this. And this is just one of the many aisles that you might see at the pharmacy with all sorts of different products. So how do we choose, and how do we go about even doing this? So we want to think about medication appropriateness, and we're going to be talking about that. We'll be talking about just some very common OTC supplements and herbals. This is really just to kind of get the thought process going so that people can actually think about what they're taking and maybe some of the whys, and is it appropriate, and start formulating those questions to have conversations with those that are your providers, the pharmacist, maybe doing a little bit of research. So we're only taking a few products today, just because I just want to do that kind of overview. And then what do we select, and why are we selecting things, and how do we go about doing it, and are we making good choices? And this is really all of that really huge small snowball that then becomes the snowman, that we really have to be thinking about, like, what we're doing, what we're adding on, and if we should be continuing medicines. So the first thing I want to talk about is the Medication Appropriateness Index. And this is 10 questions that we can as I teach this to the pharmacy students, as to this is what we should be thinking about when we are filling a prescription or if we're evaluating a prescription for somebody. And I love to share this because it's really anyone can use this as a format to be thinking about, is what I'm taking appropriate, or is what I'm prescribing appropriate, or a patient's asking me for a med review, is it appropriate? So what is the indication for the medication? So what is it actually being used for? And is it really supposed to be used for that condition? There's a lot of social media out there to use products for various things, and it might not even be a proven product for that. So you have to be careful that what we're taking is really indicated for whatever problem we're hoping it will take care of. And then, is the medication effective for that condition? So are we even using a correct dose for that indication? So we want to make certain that the med is being used for the right condition at the right amount. We want to make certain that we're taking it appropriately. So what are the directions? Is it practical? Can I, as a consumer, can I take this? Can I open, or can I spray, or can I use an eye drop, or whatever it might be that we're using? Are you able to manipulate the product if you need to? What about drug-drug interactions? So when we're thinking about this, are you already taking other meds? And are there some interactions with that? What about drug disease interactions? So sometimes we treat something that's an issue, but we make something else worse. So for example, and I'll show some more examples about this, but like cough and cold, okay? We take a decongestant or for allergies, or, we're stuffy or congested because we're sick. And then we take a decongestant. Well, decongestants can increase our heart rate and increase our blood pressure. If we already have those issues, if we have an increase of heart rate because of AFib, for example, and a type of arrhythmia, or if we have high blood pressure, that's not the right med for us. So you might have seen commercials like, oh, you can take this one if you have high blood pressure for cough and cold. Don't take these other ones. And the reason why you can take those is because there's not a decongestant in those meds. So those are things we have to be careful of. We don't want to be taking something that's going to make something else worse. So that's the whole drug disease interaction to be thinking about. Duplication of therapy. A lot of folks will take a supplement or an herbal, thinking like, oh, all right, I have a thyroid condition, so now I'm going to take this and help my thyroid condition, but they're already on thyroid medicines. Or I heard this is really good for blood sugar, so I'm going to take this, and I'm also taking lower blood sugar products. We can get into trouble with these things. We can be duplicating medicine so much so that we end up having an issue, that we're over treating certain conditions. So we have to be really careful with that. And then we have the duration. So how long should you be on something for? As a culture, we love to be on things for a really long time. Other cultures change things up. When you think of Chinese culture with herbals and things like that, they're constantly changing the herbals that people are taking as to what is going on in their bodies at that time. It's not necessarily a consistent, you're on this for a very long period of time. So when we're thinking about the duration of therapy too, even if we think about some products that I'll be talking about a little bit later on, but things for stomach acid, we don't need to keep our stomach acid suppressed forever. It might just be for a small period of time to help us through some indigestion, but we don't want indigestion, so we just keep taking it and taking it and taking it, but we're actually reducing nutrient absorption by doing so. So there are issues with keeping medicines on for too long. And then also, is it the least expensive alternative? And, some people are brand shoppers. They only want the brand name only. But when we're looking at medicines in general, prescriptions and or non-prescription, sometimes you can certainly take the less expensive version of that product and still have a great outcome and not have to break the bank having to do that. So, these are things that we like to think about with medication appropriateness. Now, when I start thinking about patients or, individuals taking over the counters, my knee-jerk reaction as a pharmacist is, why are you taking it? What other meds are you taking? And could you be treating a side effect? So, is there an issue that you have? So, you start taking a medicine or you're taking multiple medicines, and now you have constipation. We were talking about laxatives before. And so now you start taking, something for constipation. It could be that your medicines are causing this, and yet you're not thinking that, not knowing that, and you think you have a new problem. So you self prescribe an over the counter, when really what could be happening is you could switch up your prescription product by talking to your providers to a better alternative that is not going to cause constipation for you, so that you don't have to take something for constipation, that you don't have that, so that you don't experience that side effect. So when I talk to folks about, so why are you taking this? I want to know what they're treating, what's their value. When people go to the pharmacy and they research and they pick something up and they buy it and they take it home and they open it and they take it, that's a lot of steps. That shows a lot of value in that product. People wouldn't do that if they didn't think they needed it, or if they didn't think that there was going to be some value. Oh, I'm taking it because I heard it was good for my cardiovascular health. But is it? Is it really good for you? And we're going to be talking about some things about that too. So there's all sorts of different ways that we can be thinking about whether it's we're supplementing to prevent something. Maybe we are, maybe we're not, or maybe you're treating something, a side effect from other meds that you're taking. So I like to know the why, and I try to look back and go, well, you might be self-prescribing. You might be doing your own prescribing cascade, which is what we're going to talk about now. So prescribing cascades is when you take one product and it leads to an issue where you then need to take another product. So we just talked about decongestants before, and some people take decongestants such as pseudoephedrine chronically because they have chronic sinus issues and they have chronic congestion. When they do that, they might be doing over the counter and, gosh, this is weird. My blood pressure is going high, or my heart rate is really high. And then you go see a doctor, and you don't necessarily say that you've been taking pseudoephedrine or a decongestant over the counter for some time. And now you're put on a product, a beta blocker for blood pressure and heart rate. That's a prescribing cascade. You're taking one thing, it's causing something else, and now something else is being taken to help that. Another example, omeprazole, it's a proton pump inhibitor. It's used for stomach acid. People use this instead of only using it for a few weeks, up to like 8 weeks. Instead, they're on it for years. Well, after 1 year of being on omeprazole and other proton pump inhibitors, such as omeprazole, people might develop something like leg cramps. And now they're going, oh my gosh, I have such leg cramps. And they go to the pharmacy and they ask what's good for leg cramps, or they check out online what's good for leg cramps, or they talk to a friend and they learn like, oh, magnesium is really good for leg cramps. So then they start taking magnesium. They didn't realize that the omeprazole that they've been taking reduces the absorption of magnesium from our diet, and it causes a magnesium deficiency. And that magnesium deficiency causes leg cramps. So again, there's a whole prescribing cascade that has occurred here. The other thing about magnesium too, just an important FYI, is our heart is also a muscle. When we have low magnesium, we are putting our heart at risk for having arrhythmia type issues. So we want to be super careful about, how long we're taking things for, and if we're taking things longer than what they're intended for. So we have to be reading the back of the labels. How long should I be taking this for? When is too long, too much? NSAIDs, things like ibuprofen or naproxen, these can also increase blood pressure, and it might lead for somebody going to the doctors and then needing a product such as in the families of an ACE or an ARB, such as lisinopril or losartan. Those are blood pressure lowering agents. The one thing about this, though, is if it's unknown that you've been taking ibuprofen or naproxen around the clock, or a couple times a day for some type of issue, pain, chronic pain, or whatever that you're alleviating, there's a drug-drug interaction between NSAIDs and the ACEs and ARB type of medications, and it can cause an issue with your kidneys, and it can cause an acute kidney injury. So we have to be super careful about this, and we have to be careful about what we're combining, and then what is being prescribed later on for an issue. Are we causing a loop of drug-drug interactions now and then further issues? So these are some things with prescribing cascades that we might not even be thinking about. So it's really important that you communicate what you're taking with your healthcare providers. Don't think it's not a big deal because, oh, it's over the counter. It doesn't really matter. That wouldn't be causing this issue. For herbals and supplements, instead of some of the standard type of effectiveness and studies, instead they're ranked a little bit differently. So they can be effective, they can be likely effective, they can be possibly effective. There's a lot of regulations that aren't happening with herbals and supplements like they are with drugs, like with products that are over the counters that used to be prescriptions and now might be over the counter. Herbals and supplements are different, and they're ranked differently, and they're not regulated. So I think that that's an important thing for folks to understand, that they're not FDA approved, whereas actual drugs products are, pharmaceuticals are. What are some of the concerns with herbals and supplements that I have found throughout time in my studies and in my teaching is we might run into things that people aren't necessarily aware of. Things like increased bleeding risk. There are some products that might increase the risk of bleed. So if we're taking anticoagulants and then we're also taking other supplements, we might be incurring an increased risk of a GI bleed, a stomach bleed, for example, or nosebleeds or things like that might be happening. There are issues with metabolism between some herbals and supplements and then drugs that we're taking. So there's competition there. Some herbals and supplements might cause a high or a low of blood sugar, so that can be an issue. Drug duplications, like we talked about before, allergic reactions, some of the natural products we might be sensitive to, especially if we have like hay fever type of allergies and things like that. There's some crossover there. And then hormonal effects. Sometimes we might have some hormones changing due to herbals or supplements. And we could talk about each one of these things individually and talk about all the products, but just kind of want to give you an overview. If any of these are a concern for you, you might want to be thinking about, is what I'm taking appropriate? So I'm just going to give you an example of a supplement and omega-3 or fish oils. And what's interesting about this is a lot of folks take it thinking like, oh, this is really good for me. It's good for my heart. Fish oil, fish is really good for you. And it is. Fish itself, fish that you eat, is really good for you. However, when we're packing it into a pill, there's a couple of different forms. There is a prescription and an over-the-counter, and they're different strengths. But what we do know is that there are some benefits to fish oil. They reduce triglycerides. It's an anti-inflammatory. We might see it being used for vision purposes, tear production, and helping with cataracts. And there might be some cardiovascular benefit. However, there's also risks to omega-3s. And one is increased risk of bleeding. So if we have someone who's taking fish oil and then they're also taking an aspirin every day because that's cardioprotective, and then they're also on an anticoagulant, or they're taking an antidepressant, for example, all these things increase the risk of bleed. So when somebody ends up in the hospital for a GI bleed, there's probably 4 different things that they're taking that might be increasing this risk. So we have to be careful of that. You just want to know, are you increasing your risk? And so how would you know? Well, you can see if you're bruising easily. If you're bruising easily, then you might be taking some products that have anticoagulant type of properties or bleed risks. Do you have a lot of nosebleeds? Do your gums bleed easily? Those are kind of the first ideas. We want you to report those and to understand that products could be doing that you're taking so that you don't get into the trouble of the GI bleeds and things such as that. The other thing that people are really surprised about is that fish oil can actually increase LDL, which is your bad cholesterol. And this is really shocking to folks. But if someone's taking a statin and they just cannot get that LDL down and they're taking fish oil too, it could be because the fish oil is keeping that LDL from being reduced because it's keeping it up to a level, or it even could be increasing it. So it's kind of like the battle, right? So if you have stubborn LDL and you're taking fish oil, it might be appropriate to talk to your doctor or pharmacist and worth a trial to stop fish oil, see if it's appropriate for you to do that, and then see if your LDL is reduced at that point. This doesn't matter with age. I've had young athletes who actually I've talked to their parents and they're like, I don't understand what's going on. And they'll tell me that they're taking fish oil for like joints and things. And but their LDL, there's a concern now that their LDL is up. And I said, well, it's probably the fish oil. And they're like, oh my gosh, had no idea. So before adding the statin or continue or upping the statin, see if there's fish oil. That's an issue. So there's a lot of common supplements that we take. And there's a list of them here. We're just going to go over the first couple just to kind of talk about them a little bit. Vitamin D and calcium tend to be ones that are used pretty regularly. So for vitamin D, here up in the Northeast, we actually have a deficient vitamin D. For the most part, the majority of people have low vitamin D. So it is important that we do supplement it. The RDA, which is what's recommended dietary allowance, is 400 international units. However, that is not enough for a lot of us to even get our levels up to what we need to if we are deficient or to prevent fractures. So a lot of studies have shown some changes here. What's recommended is actually the 800 to 2,000 international units. And we want to try to target a serum level of 30 to 100 nanograms. So if you do get your blood work done, those are the numbers you want to be looking for. So we want to probably think about if you need to increase your vitamin D levels, you want to be thinking at least 1,000 international units in order to start increasing that vitamin D level. You should wait 6 weeks at least before having your vitamin D rechecked. So it's good to see if your supplementing is appropriate. And just know that vitamin D is really important for our muscles and for our bones. It's good for both. So if you're kind of feeling fatigue, muscle weakness, and there's concerns about just like strength and feeling strong, it could be that your vitamin D levels are low. So it's a worthwhile conversation and obviously easy enough to supplement, but just make certain that you're taking the right amount and reviewing those doses. For calcium, we have to be careful with calcium. Calcium is not more the better in this regard. There's definitely a maximum dose per day. And it's typically 1,200 milligrams for women over 50 and 1,200 milligrams for older adults in general over 60 or 65 years old. So why do we want to limit it to this? Because there is a cardiovascular risk with too much calcium. So we want to make certain that we are not causing worsening of another condition. So we want healthy bones, but we don't want to cause any cardiovascular issues. So dietary intake is best again. And so how do you determine how much of a supplement you might need? I've seen so many times, especially through the past years, especially in my early practice, that so many people were taking, 600 milligrams of calcium twice a day. So they're taking all of their calcium supplement as a supplement form, not even considering what their dietary intake is. And it's really important that we look at that. So it's a good idea just for 1 week, keep a food diary and just try to figure out how much calcium you're having throughout each day throughout the week, and then get a daily average of intake. And then you can figure out what your supplementation should be at that point in time so that you can just supplement only what's necessary for calcium. Calcium citrate is much kinder to the stomach. So if you do have a lot of stomach upset with calcium, calcium citrate is the better form to look for versus calcium carbonate, which can be a little bit more harsh to the stomach. So I want to talk about some common over-the-counters. So we talked a little bit about NSAIDs. We're going to talk about aspirin, diphenhydramine, and omeprazole. We're going to talk about each one of these separately. So for NSAIDs like the ibuprofen and naproxen, like I'd said before, these can increase blood pressure, so we have to be careful about that. Fluid retention might be noted. So if you're, like, say you have an acute injury and you pulled your back out or your knee is painful for some particular reason, and you start taking ibuprofen or naproxen around the clock. So, every 8 hours, every 12 hours, depending upon which product you're using. And then like a week in, you notice like, oh, my ankles are getting a little bit swollen. That is probably because of the NSAIDs. They can retain fluid. They can also cause kidney dysfunction. So they can cause acute kidney injury. And so we want to be super careful of that. Also, NSAIDs can increase the risk of stomach bleed too. So if you're taking some of those other products I was talking about, and now you're taking some ibuprofen or naproxen, you might be insulting your stomach too much so that you end up with a GI bleed. So lots of things that we need to be careful of. What also is very important is that we look and see all the different products that we're taking, and if there is some type of NSAID, ibuprofen or naproxen or even aspirin in those products. So things that are for pain or fever, anti-inflammatories, those are going to probably have an NSAID in them, especially if it's anti-inflammatory. Cough and cold medicines have a migraine medications, and then there's some combinations even with prescription strength. So we want to be super careful of what we're taking and how much we're taking in the NSAID world. Aspirin is another product that a lot of folks take, especially older adults, thinking they're doing their body some good in regards to, taking a baby aspirin a day because I heard that that's really good and good cardioprotection. There is some cardioprotection with aspirin. However, it's for secondary prevention. So what does that mean? If someone has already had a previous event, such as a heart attack, then they would use aspirin. So to prevent another heart attack from happening. If you've never had a heart attack before or other cardiovascular event, then aspirin is not ideal for you, and you're probably increasing your risk of bleed versus benefiting your body by preventing something. So you want to be very careful about this very common product. There's enteric-coated versus non-enteric-coated, and that just is kind of helpful for not bothering your stomach quite so much. However, if you are having a heart attack and you are to take an aspirin at that time, you want to make certain that it's not enteric coated, or if it is, you got to crush it and take it because it'll take too long to absorb if it has the enteric coating on it. It does interact with other NSAIDs. So if you're taking aspirin and you're taking, say, ibuprofen, you need to separate that, because what happens is the aspirin and the ibuprofen, for example, are competing for the same receptors. And if you're taking aspirin for cardioprotection and you're taking ibuprofen for pain or inflammation, the ibuprofen will probably win out and the aspirin will not be able to do its work. So you're not getting that cardioprotection like you're hoping for. So you want to make certain that you take your aspirin first and wait a couple of hours before you take ibuprofen. If you take the ibuprofen first, wait at least 4 hours before you take aspirin to separate those two. And then, of course, that there's we want to be careful with interactions with other meds. So like we talked about, other anticoagulants that increase the risk of bleed, for example. And then sometimes people are given proton pump inhibitors, those acid reducing products, if they're taking aspirin to help protect their stomach. So that's a whole prescribing cascade that is sometimes acceptable depending upon the patient and what their needs are. Diphenhydramine. This is used in a lot of products, over-the-counter products. It's used for allergies, it's used for cough and cold, and it's also used for sleep. So diphenhydramine, a common brand name for this is Benadryl. And but diphenhydramine is what we'll see in those PM products. So if you have some pain relief with PM after it, like acetaminophen PM or ibuprofen PM, these products actually have the diphenhydramine in it. And what diphenhydramine does is it causes you to be sleeping. So that's why it's in these products. It's an antihistamine, so it helps with allergies, but it also causes, as a side effect, sleep. So therefore, it's used for its side effects. It's used as a sleep agent. But diphenhydramine can also cause confusion, dry mouth. It can cause urinary retention, so you have difficulty urinating. It can increase your heart rate. It can cause delirium. It can increase risk of falls. And some people will say that they take it at night, they wake up the next day and they almost have a hangover effect from it. So we really want to avoid this product, especially in our older adults, because we want to avoid the increased risk of falls. I've seen many folks that take it and they're like, oh, I've never fallen before. It doesn't matter, but our bodies change and we want to be proactive about this. We want to try to not take this medication, especially every night, because we want to reduce the risk of falls. So it's really important that we address this before the fall. You don't want to wait for the fall to then stop the product. It's also important that we avoid this product for those that have glaucoma, that already have urinary retention issues, those that have cardiovascular disease. So want to be careful of that. And like we talked about, it's found in many OTC products. Omeprazole is another one that is an issue. This is a proton pump inhibitor. There's many over-the-counter products, but we want to be really super careful of this. Omeprazole is brand name product is called Prilosec. And we want to be super careful about how much we're taking and how long we're taking this for. So at most, up to 8 weeks is what's recommended. Typically less than that is what's necessary. Unless you have some type of esophageal issues, Barrett syndrome, things such as that, where you need to take a proton pump inhibitor every day because of some diagnosis. Just taking it for acid reflux or GERD indefinitely is not appropriate use of this medication. It can increase the risk of pneumonia, C. diff, which is an infection and causes excessive diarrhea and typically hospitalization. It can increase the risk of fractures because of the nutrients that aren't being absorbed. And it also causes magnesium deficiency, which can increase the risk of arrhythmias. We need to taper off omeprazoles and other proton pump inhibitors slowly, especially if you've been on it for 3 or more months. So you can imagine those taking it for years. You've really blocked acid in your stomach for some time. If you were just to stop taking it, you might get something called acid rebound, and it's a horrible feeling of horrific acid pain kind of thing in your stomach. So, and you'll think you need the product, like I have to have this, but it just needs to be tapered off very slowly. You can use some products, the over-the-counter products like Tums or, things such as that. If you're tapering off these proton pump inhibitors and you have some issues, you could try that as you're slowly tapering off. And like we said before, sometimes people do need proton pump inhibitors for various reasons because they're on an anticoagulant, for example. We want to be careful of that and make certain that it is being used for appropriate purposes. Another issue with over the counters I think is super important is to think about brand extensions. And when we talk about brand extensions, it might sound really funny, but in pharmacy school many years ago, we always did our brand names and what's the generic, right? So we had to know both. And it was very specific. So one product, that's the brand name, and this is the generic name for it. Well, through the years, that has changed, unfortunately. So when someone says Zantac, we don't know if they have old Zantac at home because they mega bought it some time ago and they still have it available for them. And that would be ranitidine in that product. Or do they have the Zantac 180, which is, I'm sorry, 360, excuse me, 360, which is the famotidine now, and that's a different product. It's a different medication, same family, but it's a different entity within the same family. So that we have to be careful of, right? Claritin tablet is a very different product than Claritin I. If you tell somebody that at the doctor's office, oh, I take Claritin, and you don't specify that you're taking the tablet or that you're actually using the eye drop for allergies, two very different products that you're using. So we have to be very careful. And this is just a couple of examples, but you have to be very specific about what you're taking and understand what you're taking on those labels. If you think about some pain relief too, we have, different products that are brand name and then like for pain relief, but then they have the migraine formulation or the arthritis formulation. Those are all different, and we need to be very specific about what we're taking so that we know as healthcare providers if there is any issues with the meds that you're taking. So I just wanted to take note of what labels look like when we are buying over the counters, because a lot of people don't look at this and it's really small, and is it really important if it's not big and bold? We have to, yes, it is. It's the fine print that we really do need to be looking at. So one thing is the print, right? That is an issue with over-the-counter labels. There are things that we talk about, like what is in the drug itself. Sometimes there's one product listed, but sometimes there's many. And I'm going to go to the next slide because I blew up one that looks a little bit better. But these are all very important aspects of an over-the-counter label, what the uses are, warnings, do not use, and it tells you, like, if you have other issues too, ask a doctor before, ask the pharmacist before. It talks about stop using if, and there's directions, and do you understand what these directions mean? And are you actually looking children or adults? Which order are they in? What about storage? And then there's also inactive ingredients as well. So you can see that there's so much information packed in here, but it's important. It's important that we look and see what if this, over the counter is appropriate for us. Now I want to forward to what a label looks like that's a supplement. And a supplement is very different. It's almost like a food label. It gives a serving size. I don't know if anyone has ever really noticed that before, but it's a serving size. And it gives you calories. And it tells you, kind of the fats that might be in it or any other vitamins or, whatever might be in it. It looks like a food label. And then it might also tell you other products that are in there, but very, very different. It doesn't go through and tell you all of these things like be careful of and warnings, and this could increase the risk of bleed, and this is what it's used for. And, where the over-the-counter products, the actual pharmaceuticals give all sorts of information. In the supplements we take, and we don't have those warnings. So we got to be careful with them. We have to really be vigilant about what we're taking and communicate that. So just to let you know a little bit about my book, MedStrong, Shed Your Meds for a Better, Healthier You. I have a 5-step medication optimization plan, which really makes people go through and think about the meds that they're taking. Why are they appropriate? All of these things that we talked about today. I also have a new MedStrong workbook that just came out. It gives you this very proactive approach of the 5-step medication optimization plan. And it really takes you through the steps in a very friendly way, color-coded pages to help you through the process as well. So I do hope that you find this information interesting and available. You can connect with me, follow me, and I hope that you found this informative. So thank you very much.
You talked about the medication appropriateness index and how, and you listed off many wonderful questions to consider. Do you, and I'm sure it's great for providers, for people who are the consumers, the lay people, what are just the key points that you think, if you were to condense it even more, what should they have top of mind?
I think it's really important that we think about why we're taking something, right? Is it appropriate? Did you actually, research it? Do you know for a fact that it's approved for this? Is it effective, especially if it's an herbal or something? Maybe you don't know that. Maybe you heard it was good for something, but you don't really know. So how do you go about doing that? So there are various resources out there that you would, you could either ask somebody who is in the medical field, or there are natural resources out there that are very helpful in understanding herbals, for example, or supplements. So really find out, think about why you're taking it, and is it really, approved, or is it important that you take it for that particular purpose? So, for example, leg cramps. Is it magnesium really? Or, is it better to take something else? So, be thinking about that. So I think it's really important to understand the reason, and is it appropriate? The dosing is super important too. And so what we'll find is that sometimes people are underdosed, and so you're taking it, and you're not really getting effect. Or some people are taking way too much. They're mega dosing on it and getting into trouble too. So we want to make certain that the dose is appropriate. So I think those two things are super important, that you're taking it for a particular reason and that you're dosing it appropriately. I think the third thing is just to make certain it is the appropriate product for you, yourself. Don't just rely on what you're hearing somebody else is taking. It worked for them. I'm sure it's going to work for me, because what you're taking and your medical needs are very different than your friends, family members, something you hear on social media.
Because that's a pretty common referral, right? You have the friend to friend referral kind of, right? It worked for my neighbor. Why don't you try it? So I'm going to try it.
Yes.
And then the person, ends up with some sort of a reaction from trying it. So really be, especially for the people who, seem to be very sensitive to different types of formulations, because you just need to know. As far as you mentioned towards the end, the ranitidine and the Zantac, boy, that brought back memories when I was in bedside nursing, because Zantac back then was the stomach medication. So, and with 150 milligrams that we would give. And then eventually it became over the counter. And I got really nervous. I'm like, how can Zantac be over the counter? But then I noticed it was half the dose that was prescribed by a doctor. So because of that, it was 75 milligrams. So I said, oh, that's interesting how marketing or pharmaceutical companies are able to bypass that particular type. But really alarming that Zantac, the 360, is actually another medication, not the Zantac that we all know of. How is that possible? And why would the FDA approve that? Because it's confusing.
So it is confusing. And that's really, it's shocking to me, because when I see this, and it's like really eye-opening, right? To go, oh, it's not this product that's in there that we're thinking. So what happened is ranitidine is no longer available. So they found that there were some issues with the product itself, and that it was contaminated with products that might increase the risk of cancer. So they couldn't like kind of get it under control. So ranitidine is not available, at least in the United States. So, but Zantac itself, right? It's a known brand name, and now their product has gone by the wayside. So, as we know, marketing can take this brand name and then add something else to it and make it something else. So therefore we're seeing that a lot, but we've seen it well before just the Zantac. We've seen it with, any cough and cold. You have your Dimetapp, and then you have your, Dimetapp DM or your Dimetapp, like there's all different letters after it or numbers or something like that. And that changes the ingredients in them. So DM means that there's dextromethorphan in it, which is a cough suppressant. But so it's still the same product, right? Dimetapp, but now they've added in something else, or they've changed it a little bit. So we'll see that with Tylenol too. So I've heard stories of people going to the store for Tylenol, and they end up getting Tylenol PM, not realizing that they just got something with the diphenhydramine in it. And so they're taking Tylenol during the day for pain or, whatever, and they're falling asleep now, and they can't figure out why they're so exhausted, because they grabbed the PM and didn't realize it. So there's a lot of that issue. I've had people at the hospital who were taking Excedrin migraine, and it had NSAIDs in it. It wasn't just acetaminophen, and they ended up in having some acute kidney issues and caused issues with other meds that they were taking, so that they couldn't clear certain meds. So they had a toxicity of medicines, not realizing that what they were taking actually had an NSAID in it, which was causing an interaction. So we can see a lot of this. I only gave just 2 examples, but even Claritin, right? Claritin is loratadine, but those eye drops are ketotifen. So completely different products. And if someone just says Claritin, oh yeah, I use Claritin because I have itchy eyes. If you don't say Claritin eye or Claritin eye drops, you're like, okay, so you take loratadine. That's going to be the knee-jerk reaction, I would think, for the majority of caregivers, is they take loratadine.
My goodness. So I guess the rule of thumb is when you see your provider brown bag all of your medications, including your over-the-counter and also your supplements, everything that you're taking, right? Just put it in the brown bag.
Yeah. You have to be very specific. You really do. Yeah.
Yeah. Now you mentioned receptors and aspirin and NSAIDs, how they can compete with receptors. It reminded me again, back in my bedside nursing years, some patients, as you would know, take a lot of medications, a lot. And sometimes the patients would say, oh my goodness, I have a medicine cup full of these pills. How will these pills know where to go in my body? How do they know where to go? I'd say, well, they're formulated to go to different parts of your body to do what they're supposed to do, which basically is really as generic of an answer as I can give somebody.
Sure.
So can you talk a little bit about what are receptor sites in the body, and how do medications know how to get to that receptor site to do what they're to do?
So the medicines aren't that smart. So medicines get absorbed, and then they get distributed. And when they get distributed, they're going all throughout the body. And it's like a puzzle, right? So this particular product has an affinity or a likeness or wants to be with a particular receptor. That's how they're formulated. So the drug itself is throughout the entire body. That's why we have so many different side effects, because we might hit different types of if you like, say, for example, you have something for your heart, for blood pressure, it still might cause some dizziness, or it might cause you to urinate more or something like that. Like there's different things happening because of various receptors throughout our body. But anyways, so what happens is it has an affinity for particular receptors, and the research is all, I don't research it. But anyway, they are able to work within that area of the body and either block or a certain receptor, or initiate a receptor to take action, if you will. So that's all the science behind it is. It is actually throughout our entire body. Some products don't get absorbed very well and they stay in our gut. Others get absorbed in our blood. Others are absorbed through our muscles, through fat in our body. So they're all different. They're formulated in various ways. Some cross the blood-brain barrier, and some do not. So we get different side effects and different effects of medicines because of the way that drugs are formulated, and then they're able to, in a very chemical, like minute way, make a change and either block or allow for some type of reaction to occur to provide the deficiency that our bodies might have.
Yeah, it's almost like a key and lock type system.
Yeah,
Inside,
absolutely.
either outside of our cells or inside of our cells in the body.
Yeah, exactly.
And it's up to the pharmaceutical industry to try to, the scientists there to try to figure out how they want to manipulate that chemical, so that way it goes to the particular part of the body that it's supposed to help.
Right. And then what they find is, as medicines evolve, they do get smarter in that they're formulated to only hit certain receptors. So there are some that are very selective, and that's what we're getting better at, is having our drugs be more selective for certain types of receptors. And they're learning, like, does it have to be more fat or more water soluble, or like how where does it need to attach and how does it do that? So it's fascinating, but it is really medications that are in the same family of medicines. For example, they're chemically changed ever so slightly, and that's why we have different side effect profiles too, is because we're trying to eliminate some side effects as we're learning what's going on with the medicines.
For example, the Benadryl and the Claritin example, right? One's the first generation.
Yep.
Older generation. That's what we use Benadryl for. Allergies, all allergies. But now they've created other ones that's in the second generation, that's like the Claritins or the Zyrtex, that does not cause the drowsiness so much for some people.
Right. Exactly.
They're becoming more really exact in what they want to, how they want the medication.
Absolutely.
What is that one thing that if somebody was to just say, oh, I learned this from Dr. Donna?
Medicines can be very helpful, but they don't have to be legacy and continue. There comes a time when our bodies change, and that risk versus benefit of medicines can shift. So we want to make certain that we're taking only what we need, what's appropriate for us at this time. And so we need to keep the conversations going. We need to be constantly open to maybe making some shifts, or maybe stopping a medication, maybe switching a medication, or just even lowering a medication just so it's safer for us and appropriate.
Donna Bartlett, thank you so much for being on the program today. We learned so much from you. Appreciate that. Would love to have you back again, if that's possible.
Yes.
And I also want to thank the Quincy Health Department for the sponsorship of this program, Aging Strong. So until next time, everybody, this is Debbie Lynn Toomey, Tufts Medical Center's Injury Prevention Coordinator. Take care and be safe. Bye-bye.